So we care for children with severe kidney disease, those who are near needing a transplant or need a transplant already and on dialysis. And there are two options for kidney donation. That is a deceased donor kidney or a living donor kidney, and both are beautiful gifts. Though you must say that living donor kidneys tend to last a little bit longer than deceased donor kidneys for all comers. And living donor kidneys are easier to prepare for because you can schedule it and prepare the family. For some children, they don't have any living donor options. That just may be because of the general health of their family, their neighbors, their blood type. And that's why some children, though they may want a living donor kidney, don't have access to a living donor kidney. When we're looking for a kidney organ donor for children, we're actually preferentially looking for adult donors. The surgery itself is made easier when we have adult donors. When people think about becoming a kidney donor, they may be concerned that how will they do after donating one kidney and only having one kidney left. The process to undergo the evaluation to be a donor is pretty thorough. It usually starts with a medical history to make sure that someone doesn't have any obvious flags that they shouldn't proceed for the evaluation, something like they have kidney disease themselves that would make them a poor donor. Should they pass through that, then it begins with some kind of common blood studies and urine studies to look for general kidney health and general health. And should that go well, then the next stage is imaging, and there's different types of imaging to look at, make sure someone has two kidneys and has relatively normal anatomy, and that can be by a CT scan. With respect to the recovery time for someone who donates their kidney, they're typically in the hospital for about 2 to 4 days, and then they go home. They do have follow-up in the outpatient adult kidney clinic and surgery clinic just to make sure they continue to heal well. Some people may feel tired for a couple of weeks, but most people can feel pretty well after a month. So what makes non-directed living donor kidney transplant so important and precious is the effect it has on the child. So if we compare children to adults, children are in this process of growing and developing and learning. And when they don't have good kidney function, they may not do well with respect to growth and learning and feeling well. So for someone who's in the position to be a non-directed living kidney donor, that donation changes that child's life. With respect to their general health, their education, their social functioning. It's just incredible.